Thank you, Jim. I'd like to thank you and your colleagues from NCOA, Howard, Ken, for asking me to help with this project. I was very interested in doing this survey, given that the subject has been in the media and in discussion, public policy debate for so long that it was very, very interesting for us to be asked to tackle this assignment. And I'm very happy to share with you the results of the survey that we did. I'll first take you through very, very briefly the methodology of the poll, but then I will get into the overall findings, the detailed findings of the survey. Excellent. This survey was conducted very recently. We only finished it a couple of weeks ago, so we did the survey in July. We did the survey by phone among a national cross-section of people age 65 and older. We interviewed over 600 people, 636 to be exact, and we feel this is a very good sample for this particular survey. Before I get into the overall, the detailed findings almost on a question-by-question basis, I want to just give you a very brief overview. We looked at familiarity with the new healthcare law, and what we found is that very few older Americans, 65 and older, say that they are familiar. Is that better? They are familiar with the law at all. Very few people say they are very familiar with it. Only somewhat more say they are what we would say is somewhat familiar, and a significant number say they are not familiar at all with the law. And further to that point, very few people say they are actually satisfied with the information that they've been receiving about the law. And then specifically, most people don't know the impact will have on things like the federal deficit or the benefits that they received. This survey, again and again and again, you'll see a common theme as I go through the results. People are just not, they don't know whether the information in the law is true or not. As I said, few people know the benefits in the law. They don't have, they're not confident on the information about Medicare Advantage program. And specifically, we asked a whole series of statements. There were 12 in all. There were true-false statements. So each question was presented as a statement, and we asked people to tell us whether they thought the statement was true or false, or they didn't know. And what we found, and I think this is, I was very surprised by this, was that very few people were able to answer statements correctly. 44%, as you can see, or maybe you can't see, I'm not sure I can. 44% were only able to correctly pick 3 out of the 12 statements correctly. And only a quarter were able to answer half the statements right. Further, very few, 9%, less, just about 1 in 10 of the people who did our survey, so it was, got 8 or more of the statements right. So let me now turn to some of these specifics. First, on familiarity with the healthcare reform law, we asked people how familiar they were with it. And very few people, as I said earlier, acknowledged to us that they were very or familiar with the health care law. 21% said that. Another 4 in 10, 45%, said they were somewhat familiar, and 3 in 10, 31%, said they were not familiar with the law at all. We also asked whether they were satisfied with the information that they received, and perhaps not surprising, few people said they were very satisfied. About a quarter of the sample, a quarter of the people who did our survey said they were either very satisfied or satisfied with the information that they received about the law. Another 31% said they were somewhat satisfied, and actually most people, 38%, said they were either not at all satisfied or they didn't know. Now let's turn to some of the specifics. Again, we asked people to tell us whether they thought the statement that we made was either true or false. So they tell us whether they think it's true or false, or that they didn't know. The responses in the gray box in the middle are the correct responses. So to this question, we asked that we made the statement, the new law will result in future cuts to your basic Medicare benefits. 4 in 10, 42% of the people said that this statement was true, when in fact it's false. Only 22% said the statement was correctly false. And 37% said that they just didn't know. You'll see this pattern again and again on the number of people who are not getting it right, who just don't have the right information or are not familiar with some of the basics in the law. So, for example, turning to Medicare spending, the statement says to the effect that Medicare spending will grow, albeit more slowly. And here, actually, on the left-hand side, more people get it correct. 34% got that correct. 23% said false. That's an incorrect statement. But again, 43% said that they did not know. Will the new law increase the federal budget deficit? The correct answer is no. That's a false statement, that the Medicare law will increase the federal budget deficit. That is incorrect. Only 14% figured that out, whereas 49% thought that was a true statement. And over a third said they just didn't know. We asked about the solvency of the Medicare Trust Fund. Only a quarter realized that the law will extend the solvency of the Medicare Trust Fund. A majority, just over half, said they didn't know. The law obviously explores a number of benefits, and we asked some questions about that. For example, on prescription drug coverage gap. This has obviously been talked about a lot in the media and in the public policy debate. And many understand that the new law will help gradually close the gap. That data is on the left-hand side of the slide. Try saying that many times quickly. 42% say that statement is true, that the drug coverage gap will be closed by the new law. 12% say that's false. However, I think most surprising to me, 45% say they don't know. And when turning to the availability of long-term care, equal numbers believe or don't believe that the new law will improve long-term care for older people with chronic conditions. Most of the people in the survey don't know. 43% on the right-hand side say that they don't know whether that's the case. On improving quality of chronic care, the new law will improve the quality of care for those getting Medicare with chronic illnesses. However, many incorrectly indicate that the law will not improve the quality of chronic care. A third said this statement is true, and again 45% said they do not know. The new law offers free yearly wellness visits. This is provided in the law that only a third of the people tell us that they know this. 13% say this is not going to happen, it's a false statement. However, over half, 54%, say they don't know that this basic benefit will be provided. Most believe that Medicare payments to doctors will be cut, that the law will cut their benefit payments to the doctors. Actually, this is false. 45% did get this correct. 45% said this was true, a true statement, but 41% said that they didn't know. We made a statement about that will the 32 million uninsured receive health insurance coverage? This again has been something that has been talked about for seemingly quite a long time, not only in the last year, but actually during the presidential campaign. And it's true from our survey that many realize that under the new law, uninsured Americans will receive health insurance. 43% say that is the case. However, perhaps what is surprising is the fact that 19% say this is false or it won't happen, and another 38%, or over half, either don't believe that this will happen or don't know. Finally, we asked a couple of statements about Medicare Advantage. About half, just under half of the survey sample indicated to us that they are in the Medicare Advantage program. Next slide. And we asked whether under the new law, well, we made a statement that under the new law, the Medicare Advantage program will be eliminated. This is a false statement. Only 21% got this right. In fact, only a quarter of those who are enrolled in Medicare Advantage said this. 17% said it was true, that this program would be eliminated. But by far the largest number, 62%, said that they did not know whether this would be eliminated or not. And finally, on the last slide, the last question, most of the respondents indicated that they didn't know whether the Medicare Advantage plans will cut benefits and increase premiums. This is, I think, very complicated, so actually, unlike all the other slides, this may actually be the correct response, the don't know, and many people said that they did not know that. A third thought that the Medicare Advantage plans would cut benefits and increase the premiums, the new healthcare reform law. 11% thought this would false. So in summary, overall, as you can see, the pattern here is that many people don't know about what is in the Medicare, the current healthcare reform law that was passed. A lot of people are ignorant about what is correct and what is incorrect, and that I think the survey calls out very clearly for the need for more education about this subject, which is obviously very complicated. And I think this survey helps demonstrate that. Thank you very much.